Welcome to the Alpha Wolf Impact Club. I'm Tim Weintraut, and this is where we shine a light on small companies with big ideas. Our mission here is crystal clear. We want to identify, support, and champion game changers. Those companies that are tackling massive challenges, revolutionizing industries, saving lives, or making us more efficient. For example, today we have Tim Johnson and Julia Quinn from Health in Tech. Health in Tech is an insurance marketplace innovating the self-funded healthcare insurance market for the business, the employers. Powered by third-party AI, businesses can design their own healthcare plans, purchase the health insurance seamlessly. Their AI-driven platform streamlines a complex process, enhances transparency, and empowers every participant in healthcare insurance ecosystem. Brokers, employers, third-party administrators, carriers, hospital, clinic are integrated and connected on their marketplace. This is, without question, an impact company, and they're tackling a massive problem with healthcare insurance. But I'm going to let Tim and Julia tell you more about that in just a moment. This is not to be taken as investment advice. I am not a certified financial planner. This is for education and entertainment purposes only. I encourage everyone to do their own due diligence. Hey everybody, Tim from Alpha Wolf Capital coming at you with a follow-up to a great story that is having a little bit of a hiccup right now, and I'm really confused as to why. Julia, CFO, and Tim, CEO of Health in Tech, HIT. Hey guys, what's happening?
Hey, morning.
Not much. Good morning, Tim.
Good morning. Look, I mean, the stock had an amazing run from where you and I first started chatting. I think that was in the 60-cent level, which it never should have been. And then had a beautiful run. Here we are coming up into the end of the year, and we've got a little. Did you guys have a bad earnings report or something?
No, Tim, we have great earnings, and the third quarter, we grow year over year 90%. Now, for the first 9 months, and we did a 25.8 million, which compared with the entire 2024, 19.4 million. We are 132% of last year, entire year, just for 9 months, right? So we've been, if you remember when last time we talked about, hey, we think we can grow 50% year over year. With this change of the third quarter is really strong. The timing shift a little bit because the market uncertainty, somewhat the change of the subsidy, we just shift the timing a little bit. But it's a great quarter, great first 9 months, will be great the whole year. And our earnings, we talk about the entire year, we probably will grow 70% year over year, 70. So better than 50% of zero. So we're pretty happy, and we continues to be profitable.
Tim, what do you think? What do you think the market's missing?
Yeah, I don't know. I tell you, I talk to Julie about it all the time, and that's not my field of expertise. I know how to work this company. I know what sells. I know how to build it. But listening to Julia and yourself, Tim, we've talked several times. I am not sure how they perceive things like this right after. I mean, literally the day after we had our earnings call, this whole event started falling. I do not understand that. I just don't know if they understand the market. There was some chatter going on about what because we were in the middle of the government shutdown at the time. And then when they ended up opening the government, they didn't include, I don't think they included the subsidies for, the ACA. And I think sometimes people conflate what we do with what the ACA is and the government subsidies and what that program is. But that's about as far as I can get with it. I'm not sure because it is a very complicated subject. Healthcare and how people buy it, what it means. It is, and most people don't really understand it, and maybe that's what they're missing.
Maybe that is what they're missing. I mean, that could very well be it. Maybe this is the opportunity to clarify how this isn't or shouldn't be affecting you, right?
Yeah. The ACA, we that's more of the individual government funded help with people who need help purchasing healthcare. We're not that market. We're not in that space. That's a very regulated, state specific, fully insured type of a product. We're exactly the opposite. We're a group product. We're self funded. We're federally regulated. We don't really that whatever happens in the ACA doesn't necessarily affect us. There are some very indirect effects to it, but from a direct perspective, there's no correlation between what the federal government just did and what self-funded stop loss business is.
Okay. Just overall, how are you guys feeling about the company itself and the path that you are on? How are you feeling about it?
Well, I will tell you that we have all of our technology. I mean, and last time we talked to him, Julie and I were very open about where we are in our technology. All of our technology and these new products and new features that we have with our systems were coming to fruition in the third and fourth quarters. There's a lot coming in, and we've been spending a lot of time, implementing those and making sure that they're perfected because you only get one chance when you roll out a new technology product, you don't have very many chances. It either works or it doesn't. So we're doing a lot of proof of concept, a lot of testing to make sure that it does. And rolling out in 2026, January, the first quarter, second quarter, we already have products that nobody else has. And, Julie and I were talking to you earlier. We have another product that we're working on that is a big product and a big idea. We had a press release, I don't know, a month ago, maybe 2 months ago about it. And these things are what the market needs. It's what our industry needs. The industry is going to change. Technology is going to change it. And we want to be the people pushing that. It just is, it doesn't come overnight.
Yeah, you're definitely on the leading edge of tech, right? I mean, you're trying to simplify a very complex system. Would you agree with that?
Yes, I
Very much
think.
so. There's so many players. Go ahead, Julie.
Yeah, I think, Tim, if we just lay out there are a few big block of things we did and announced being a public information. One is our capability of sell give a tool to sell the healthcare insurance for the large size of employer. Larger means 150 employee above. Today take about 3 months for the regular process. Through our system, it takes just as little as about 2 weeks. We are getting even further down from there. Use AI, uses functionality, all above to achieve that. And the two is we have a 3-year rate hold product. So it's on the marketing test phase. So we are not talking about too much about who are the partners exactly, but is, top A rated paper, top, rating agency, top investment bank, top trust. So these are the product will help the business to stabilize their healthcare cost. It's very, very cool. It's really what it needed the market. So, and then we're also working on the cross sell opportunity for the small business. Everything we do now is focused on a small business, what they need for their employees. So it's very cool. That's why I'm saying we've been busy building this product and launching the market. We are fine-tuning it. And by the 2026, we should see the full deployment and get that move forward. There are several companies runs almost $1 billion and that space, and they're doing manual. We think that's good opportunity for us to take more market share from there.
Okay. Do you feel as though you guys are becoming more recognized out there in the marketplace?
Yeah, I think so. A team can address that, and I think how many of the TPA we've been adding on. We almost hitting 874. It's a 50% growth.
Right. What do you think, Tim?
Yeah, Tim, I, I will tell you this. I, as a very small company, I mean, I was telling you back in 2019, there was two of us. And as we started to grow, I did not want the recognition because I don't want anybody, focusing on me because it would be difficult to sustain any type of competition or direct intervention. So I still keep that in mind. I know that we're public now and everybody can see us, but to be honest with you, the people that we show, the direct contracts that we have, yeah, people will see us. They know what we're doing. As a matter of fact, I mean, I don't think that anybody using our product will say that there's anything close to what we're doing. But do we go out and say to the entire marketplace, "Hey, look at us"? No, we don't. That's just not what I want to do right now. I'm getting better. I'm getting in a position where I'd like to do that, but I just prefer to run a little bit under the radar.
And I don't think there's anything wrong with that, right? I mean, that's part of the strategy. And I mean, I
Mm-hmm.
think what you have proven though is what you're doing is working, right?
Definitely. Everybody who sees it and uses it loves it. The technology is there. Everybody loves it. Nobody will say otherwise. Everybody will say, well, that's the coolest one. Nobody does that, right? For all the features that we add. But to me, that's not good enough yet. At some point, we're going to have to be where the system itself is so easy. So, people ask me all the time, in one word, what do you sell? I sell convenience. It has to be so convenient, so easy to use that anybody can do it at any time. It's the Amazon effect, right? Buy now. You got to push one button. They made it so easy, and that's the way healthcare should be. Now, I'm not taking away from this. I got to understand what I have. I understand the product because it is a very personal product. Everybody wants a good plan design, but that communication can all be simplified and it can be easier. It can be delivered better. And that's what we're trying to do is deliver the whole product better.
Which is a very complex product, right? But
It
you're,
is very.
but if somebody gets on the phone or gets it starts looking at your symptoms, they can tweak it, they can customize it to what they need, right? I mean, is that accurate?
Absolutely. Yeah. We even have rolling out in January, I think it's January, Jill, you can correct me if I'm wrong, but in January we have this AI agent that if a broker or employer or somebody wanted to see, okay, look, here's what I have. What if I move to this? Is that better? Is it worse? We have an AI agent that, because we're all creating these things where they can ask the AI agent, say, listen, is this good for me? Is it bad for me? What are the implications? The AI agent will help them. So it's available to everybody.
Just have the right prompt. That's all, right?
That's it. That's it. Yep.
I'm getting good at prompts. I mean, look, I think this is such a fascinating time, and I think you guys are right on the cutting edge, and you are addressing something. You know, I do try to focus on companies that I feel are making an impact, right? And simplifying healthcare for a small business, I think is a huge undertaking. But it seems like you guys are having some success, and I know you're working towards making it even easier, right? So I agree with
Yeah.
you, Tim. At some point, you guys do, if you do make it so easy, why wouldn't they go with you, right? You're the path of least resistance.
And remember, we really want to focus on the technology. We want everybody to use the technology, not that we want to be this where you buy and sell type thing. That's not what we are. We're the technology that people will implement because we want to make it easier. We want to make it more convenient. We want to make it faster. That's the whole point of what health and tech is. So, I don't want people confusing us with in the future with being some sort of I don't know what you call it, some insurance company because people think because again it's a very confusing, complicated topic, and we just want to be really good technology for our industry and try to figure out how do we simplify for everybody.
And you're not just, I mean, one time we spoke, you were looking at expanding this thing. I mean, you've got some grand plans. Would that be an accurate statement?
Very grand, yes.
Right? I mean, you can't let the cat out of the bag because look, it is an interesting time. This is it's look, competition, right? Everybody's looking for that idea, and you're well on your way, and you've got more great ideas floating around in that head of yours that I think are gonna pay off in the long run. This is not you're not looking to be a flash in the pan.
No, look, these changes are coming. They just are. Technology, I know that we have some very big players in the industry and they love the way the market works today because they make a lot of money off of it. They just do. But there's those small finite group of companies and then there's everybody else. And everybody else is trying to figure out what do I do? How do I do it? How do I invest it? How do I make money? All of that. We need to create, and it is coming. This technology is coming. There are technologies out there right now that help everybody, not just the big 800-pound gorillas, but they help everybody from the individual who wants to buy their own policy, their own, health insurance policy, to the group, to the small group, to the large group. That is there. It just needs to be perfected and put in a place where everybody can have access to it. That's coming. No matter what I do or no matter what our company does, that's what I'm trying to do. Somebody's going to do it. There's no doubt about it.
Right. And I go ahead.
Right? So if you look at that today, we do not really have is a functional marketplace for the healthcare insurance, period. We are building one. So that's so important. Your audience should know, and all the frustration of inefficiency, not transparent, because we do not have Amazon unlike a marketplace you can shop for and you can buy the right away, not click the button, receive hundreds phone call, taking information. The business, you can customize your stuff, you can see it, you can buy it. Insurance company, just like the store Amazon, they can open their store, they can be there to show their product. So we are creating the marketplace and using AI, building up the more functionality to simplify a lot of human process. So then, we were thinking about a lot of underwriter do a much better job of not dealing with those manual processes, but more intellectually and define the risk, the rule. So it's going to the total next level. As Tim said, whether you like it or not, the market's going that way. And we are just the one and doing it and leading it. We hope we will be the marketplace.
You just made me think something, Julia. So beyond the healthcare, maybe the confusion there, maybe the other issue too is what's the guy's name that shorted the housing crisis, Michael Burry or Burry or whatever his name is, uh, and basically he's shorting the whole AI space right now, right? He's shorting Nvidia. So maybe as I'm listening to you and you're talking about AI, using AI, you're not an AI company. You guys use AI to help, really guide you as to and think about things for the industry, right? You're not you're not an AI
Correct.
tech company, right?
Yeah.
But
No,
maybe,
we just use
maybe,
AI to make it better.
right, right. So maybe it's the tie or the perceived tie to AI that also played a role in the weakness in the stock. I'm just taking a stab at things, right? That's maybe that's part of it.
Yeah, you're right, Tim. In the market, people start to be skeptical about AI. I tell you why. There are many of the tool in the market has no ability to make other people pay to earn the revenue. In the end, the fundamental has to prevail. All right, so we've been using AI since 2021, and we demonstrate ability to not only make revenue to be profitable, to improve the process. We are not the latest AI trend and build something, have not figured out how to make a profit or have not figured out how people would appreciate pay for it. So we already moved on from using AI, prove people want to pay for it and be profitable, right? You look at the three stage, we are way beyond that stage, and not just become because AI buzzwords, we start to jump into that. So that's very important. We have almost 5 years from 2021 now, almost ending 26 now, 5 years of experience and proven to using AI to make money. So
So
important.
you guys have been perfecting your prompts for 5 years, right?
Yes.
Correct.
I mean,
Yeah.
that's a true statement,
Yeah.
right?
Yep. Yep. Yep.
I use AI every single day now. I mean, AI actually has become my best friend. I mean, I talk to AI every single day, right? And I think anybody that's not using AI is, I mean, you can literally ask anything and you can learn I mean, do you have to double check? Does it have, what is it, the hallucinations and all that stuff? Yes. You have to kind of know a little bit about what you're talking about or asking about and double check and triple check and all that stuff. But I'll tell you right now, I feel so much smarter at the end of every day because literally I learn something new every single day from using AI. And I think that what you guys have been doing is perfect. I mean, that's how you refine something. It, there's nothing's ever going to be perfect, right? There is no such thing. But we can get a little bit better every single day. And that's really what you're trying to do is make a system that is very complex, very scary to some people, right? And make it not scary, make it less scary and easier to navigate through. And you are doing that effectively.
That's it.
Yes?
Yeah, that's exactly what it is. And it isn't easy. There's a lot of pushback for a lot of different people, but that's exactly what we're trying to do. And Tim, your point about learning every day, AI should never be at 100% because then it stops learning. So anywhere between 95 and 99%, it continually learns, and that's what we want.
Right. Absolutely. I mean, look, you guys have tackled a very big industry. You've made a niche for yourself. I think the niche is going to continue to grow, right? And this is exciting. I would look at this pullback as an opportunity to if you missed last run from what did it go from 60 cents to about where you IPO'd, which was $4, right?
Yeah.
About
Yeah,
$4, yeah.
yeah. So now you're back down here. If you missed that first run, um, this would be an opportunity to start building a position. I'm not telling anybody what to do. I'm not telling anybody to buy the stock, right? But I look at it like this. This is a profitable company, which is a rarity in itself. for a new small cap company that lists publicly. Usually, it's a company that's losing money. That's why they went public, was because they're losing money and they need more money, right, to grow. That is not the case here. You guys are profitable. How many shares outstanding, fully diluted, Julia?
So the fully diluted shares today is about 55 million. And the share of, it's a flow is about 13 million. Fully flow. The rest is with the company founders and the investors. And we belong there with you team. We talk about extend our lockup because we are that committed to the company.
You actually cut out a bit on me right there. Let's just real quick, just repeat what you just said.
So the share outstanding is 55 million. The share flow is 13 million. So the remaining shares with companies, officer, directors, and the founders, we lock up until the end of December. And as we shared many times, we are happy to extend the lockout longer because that's our commitment to our shareholder and the market. And we're determined to build a great business.
Okay. That I'm glad you repeated that. I'll cut the chopped out part out of this when I edit it. But okay. I mean that's excellent, right? I mean there is support from insiders. So in other words, you got some strong hands. I don't think you guys are looking for a 20-cent scalp, are you?
No.
Yeah, this is a long-term hold for you guys, I would imagine. Yes?
Yes, given
Very.
everything we're doing, and we have strong confidence of our result and also where share price should be. Because I just want to say that at the time the IPO valuation was $4, and we grow, this year will be 70% revenue growth, maybe 80% of the profit growth. We just don't see how the market would not eventually wake up and adjust it. So let's put it that way.
You bring up a really good point, right? So that's what it's so important for people to understand that the market is supposed to be this really efficient pricing mechanism. It's not. I got news for you. So if you look at the companies like the Nvidias, and they have multiples that are insane, absolutely insane. Nothing actually is priced right where it's supposed to be. The market does like crazy things. They overshoot to the upside, they overshoot to the downside, and it really is the temperament of the market that determines where your share price is, right? And what sector's hot, what sector's not. Money rotates, and if you think it rotates logically in the market, it doesn't. It's very illogical at times. And that's what creates opportunity, right? So that's what I would say we have here. There's a little area of support right around this area, right where it's at. We've coming into tax loss selling season. So maybe you have somebody that bought this thing at $7 when you guys spiked up to there, and they're underwater. Okay, I mean that was just poor execution on their part. I look at this as an opportunity. The business is solid. How are you feeling about the fourth quarter? Are you feeling okay, pretty good about the fourth quarter?
Yeah, we talk about quarter will be year-over-year growth of 50%, 50. So it's still pretty strong. And, it's a little bit of timing shift. The third quarter, maybe, we were expecting something like 60% but grew 90% because, there are people make early So we look at now the whole year, we will grow 70% versus initially guidance we talk about 50%.
Okay. And you're just so I'm clear, and so that the viewer knows, your best quarter typically is the first quarter, right?
Yes.
Which is coming up after the fourth quarter.
That's
Right? Okay.
yes.
So I would look at it like this. You're coming up into your best, I mean, you're going to have the fourth quarter to report, and then you will be coming into your best seasonal quarter in January, right? I mean, when we turn over the new year, that's the first quarter. You guys are calendar, right? So you're not, so it should be, I would think, maybe a good quarter for you. I'm not promising anything. I'm just saying. Typically, it's your best quarter, right? The first quarter.
Yes.
Okay. So that's why I would say here at $1.40, what's your risk? What's your potential reward? The risk is you go to zero and you lose $1.40. That's if you go bankrupt. I don't think bankruptcy is on the table. I'm thinking that's not on the table, right? So what's your potential
Yeah.
upside? The potential upside is you go back to where you were just a couple of months ago, which was right around $3.50 a share. That's a pretty good move from $1.40, right? But is there the possibility that you could head back towards the all-time high of $7? Anything's possible in the market, right? So yes, you could go back
Mm-hmm.
up and test $7. I'm not saying that you're going to. I'm just saying it's a possibility. I think that's probably more of a possibility than going bankrupt. So risk reward,
Definitely.
Yeah,
risk
we have
reward.
zero debt and we don't have a warrants, we don't have all these liabilities. We just don't, and we have positive cash flow. So that probability is really remote, very far remote.
Right. So I mean, you don't have any debt. Do you have any significant debt?
Zero. No.
Okay. So yeah, you don't have, that's a killer usually at companies. You don't have any significant debt. You got positive, you're profitable. Yeah, I would say bankruptcy's probably off the table, right? So if that's off the table, then I'm looking at the upside. What's the risk reward? I think the reward is very favorable at these levels. Could it go lower? Of course. I mean, where would I really be backing up the truck? I'm talking about me. Is that if this thing went back down to $1, I'm backing up the truck because that just gets to stupidity level for me, right? You guys are doing good things. You have an amazing business that's in a very complex, tough industry, and you're making it easier for people to get covered. If you're a small business, I would look at it like this. I wouldn't be just watching this and saying, hey, HIT could be a good investment. I would be saying, hey, I need to get insurance for my people. Maybe I should check these guys out, right? I mean,
Mm-hmm.
you're helping small business, and that is what I say is the backbone of America, right? It's the backbone of a lot of countries. It's small businesses. That to me
Yep.
is you guys are just in that sweetheart spot for me. That's why I think you are an impact company, right? Because you are making people's lives better. And I'm talking about the employees that get the insurance. The whole thing is about making people's lives better. And would you say you're doing that?
Yes.
Absolutely. They have more options now than they ever had.
Right. And it's easier. It's simplified, right? And you're going to make it more
Yep.
simplified,
Yep.
right? Okay. This is
Yep.
this is a company you want to support. This is a company you can feel good about supporting, right? Because their goal is going to benefit everybody, right?
Yep.
All right.
Definitely.
I'm glad we came to agreement on this. All right. Listen, is there anything that you feel as though I've missed, that, or anything that you would like the listening audience to know about HIT before we turn this off?
I think it was a great discussion. I think we covered about everything, probably everything that we can talk about. I know that we have a lot more that we are working on, Julie and I, but until it comes to a little bit closer to development, we probably safe to not talk about it, but there's a lot going on in our space for sure.
So you're not sitting idle?
If I could tweet, Tim, I would say yes, but I'm busy all the time.
All right. So you're not resting on your laurels just yet. You're still out there aggressively going after it, right?
Yeah, Tim, we
Definitely. Yeah.
0.001% market share, right? So this market is so big, and we see a little thing we do, we help the people, and then it really translated to have a big growth. But we're not stopping here because it's really a lot there to do. We look at all this inefficiency. It's sometimes mind-boggling because I hate to say there are a lot of middle guy in the middle adding on very little value. It can be simplified and push the saving benefits to the small business owner. This happens around all other sector, but not just the insurance sector yet, because it's the last sectors with very little transparency, like with banking before. So I come from city. I know how understand that the fintech changed the entire banking. Everybody now liberalized by just take a deposit, take a picture, don't go to branch. A lot of things really help the people. And we are doing the similar things in the insurance sector now, help the small business guy. So that's our mission.
I love it. I love it. I love it. I liked you guys from the moment I met you. I liked you more after we had our first, and then the stock took off, right? And I think this is going to be one. The good thing about having being involved with the company at this stage of their life is that, yeah, it can be volatile, but if you understand the dynamics of the market, you understand, then this is just a great opportunity to replay over and over again, a good, how do I say it? This is just a great opportunity in my mind, right? I think you have a good, solid business. You guys are very transparent. You're easy to talk to. I love what you're doing. I like that you're helping the small business. I mean, you know, that's what this whole platform, my platform, is all about. Is finding companies like this that's making a difference. And I feel good about supporting you guys. Hopefully, others will too. If you're just now tuning in, this is the first time you see me or heard of this company, I would go to their website, I would sign up for their email alerts, and I would buy one share. The reason I say that is, I could get away with that. I could say you buy one share because I don't think anybody's going to go bankrupt if they buy one share and you guys went bankrupt, right? So, I mean, it's
Yeah.
okay. But what it does is it makes people pay attention to the story because they own it, right? And that's the difference. So I would say at this level, you'd be okay to buy one share, right? Now, if you want to buy 10, that's cool. You can do that too. But I would pay attention to this story because I think you guys are just getting started. This is just the beginning of your story, right? And I think it's going to be a fun one to watch, right? So that's it.
Yep.
When should I have you guys back?
Well, I think probably after the new year. By the way, we're doing the Davos, summit, and probably after come back from Davos, we have a lot of cool panel and watch out the release and the press release about all these, you know, um, Time Magazine CEO will be on the panel to discuss with team. This is already announced. And then we have all the first lady, try to change the world, discuss about other stuff. Surrounding around the insurance technology and AI and to change the world to be better. So I think we should catch up after, we come back from Davos in January. And that's a lot to talk about that.
Okay, that sounds like a good. Let me ask you a question, because I haven't even asked you. Is this something that you can roll out internationally, or is this just the States?
Oh, so internationally, it probably works better, Tim. We've had so much attention from people internationally because their systems are not as complicated as ours is. So that Davos deal is not primarily, but it has a lot to do with that. Yes.
Okay, so there is opportunity for growth internationally.
That's right.
Definitely.
Definitely.
All right, see, that's kind of important. We missed that. You guys did. I'm going to put that on you guys. I asked if there was anything else. International is pretty big. No?
It is.
Yeah, because we're still working on that. That's the reason we have not talked about that much. And we were like, hey, the Davos people pay attention to us because we wanted them to see the level of the leaders we bring in for those conversations. There's a lot of excitement will build after that. And we are the people who wanted to always, over deliver. We do not like speak something we feel we're still working on.
I love that. Under promise, over deliver. I tell people that all the time. That is so important, especially on Wall Street, because if you even like accidentally put a projection or a number out and you don't nail that number, Wall Street will punish you, right? I mean, they're just so unforgiving.
Yeah.
And that's something you have to be, because you lose credibility in their eyes. Even though many times I look at things and say, they didn't like say it, they didn't write it in blood, right? I mean, it's just some of these things that happen on Wall Street are just comical to me, right? You guys under promise, over deliver. I love the fact that we're ending this thing on the premise that yes, this could expand internationally as a little thing, right? Just a little thing. Pretty big world out there, I think.
Yeah.
Yeah, that's a big number, whatever it
Yeah.
is. You know what I mean? I'm thinking that's a pretty big
Yep.
number. All right, listen, I love talking to you guys. We should do this more often because I'm feeling pretty good right now. You know what I mean?
Good. So we.
All right. All right. We'll have you back. Good luck on your trip in Davos. Safe travels. And pay attention to this story, HIT. All right. Hold on a second. I'm going to shut this off. Thank you for tuning in to another CEO, CFO interview here at Alpha Wolf Capital. Today we had Tim Johnson and Julia Quinn from Health in Tech. I hope you enjoyed today's interview, and if you did, do us a favor. Give us a like. How about giving us a share? And while you're at it, make sure you smash that subscribe button. All of those things are extremely important to us here at Alpha Wolf Capital, and we appreciate you taking the time to do that. Until next time, stay safe. Alpha Wolf Capital wishes you the very best of success.